We're going to do the details of the hip stretch series, and we're going to do the using a traction belt on the hips. Okay, so I like to open the joint first, and so what I'm going to do is, and this is all in the maintenance treatment, but we're going to break it down. And so I feel the range of motion of her hip, and then one of the most important things you can do for your practice is point out to your clients where they have problems, because she doesn't know that her hip cannot do this, and it is not going that way. And the harder I push, the more that's going to hurt, because as I move it, it opens this way, there's a pinch right there. And later on, I'm assuming that you're going through the whole MSK Academy stuff, later on you'll find that this is a problem with the vascular system right here. But we're going to fix this using the belt, and we're going to open up the joint. And so this belt's by OTP. You get a cheap one online and Amazon, they're like 15 bucks, but this one's like 60. This pad is for her inner thigh, because that can get sore. And to set this up, that's the distance. So from your thumb about there, and you put it around your hips, right? It goes around the bones, and so not your low back. And then this threads through here around her hip. Okay, and now I have it. I've got her locked in, and now I can traction the belt and traction her hip. And so I'm very relaxed. My arm is calm, and I have it. And so then I'm going to open the joint. So I'm actually tractioning the actual hip joint itself with this. Then I'm going to, this knee always points to the ceiling, okay? We're going to do an external rotation with traction, and I'm keeping the traction, and then internal. Now, internal, external is what this bone's doing, not what this is doing. This bone's going external, that's external. Internal. And I just walk, and I open that joint. And see, as soon as this leg on the opposite side moves, I know that's as far as I need to go. And it's starting to open. Then, take it, this is all relaxed, it's calm, and then I just move the joint. So I'm doing traction without work. You want to minimize the amount of effort you use. And so there's the pinch. The pinch is that direction. And so the angle of which I need to take her leg is the same angle of her thigh, the opposite way. So I'm going this way. So if the pinch is there, I'm going this way. If the pinch is this way, I'm taking this thigh that way. So hers is there, I come there, and it's gone. I'm doing is I'm centering the joint of her hip. There's another one that way, so I'm going to go here. You put your knee on the table, just center the hip, and there. And that joint is centered. That probably is not going to stay because there's an autonomic system that's guarding, but it'd be good for like a week, right? And so she knows clearly that I did something. She can feel that that's unlocked, right? That is really important that you explain that to your patients or your clients, because they didn't even know that was a problem, okay? And so after I do that, I'm going to go on and I'm going to do the hip stretch series. And so we start with hamstring stretch. And it's here, or if you're a woman and it's a big guy, here. You just lean in on it. You can muscle energy technique, any of these. So hamstring, one finger behind the knee, so it gives it a hinge to bend on. Place it on the opposite side. One finger behind the knee. If I bump her in that space behind the knee, she will automatically bend. Here, there. Now you get on the table with one knee, and we're clothed, so getting on the table is not a big deal anymore, right? And I'm going to put that in the crook of my elbow, like that. So I totally have her here, okay? And even a big guy, you can control this way, okay? So if I pull the knee more in line with her body here, more parallel, that's more piriformis. As I come across like this, now you're getting in glute medius and the lateral glutes. And so we're just going to stretch her here. So this is steering, this is your power. I've done this on a NFL football player, this giant guy. I had to do this. So I threw my knee like this to get the power. So that's an option, right? And you want to be in a position where you're not using a lot of strength. I've done this probably 8,000 times, so I'm looking pretty good at it. You're going to have to practice, okay? And then you stretch their glutes. Don't get too crazy about this being parallel. Allow that hip to just float into its spot. And you go across body. Now this is a series, right? So we're gonna do this for a while, and right there, she needs a muscle energy technique because it's tight. So resist me, I give her a tap. She's resisting me. It's about 20% of her max effort that I want. Okay, relax. And we just muscle energy anything that needs to be muscle energied out. Now I'm gonna reach through the hole. And I'm taking this foot, dropping it down. I don't let go of that foot. I don't pick this up. We're gonna get the whole side body. I ask her to raise that arm up, and I drag it across. And we can muscle energy that. I said, don't let me pull you. And it's active, inhale, relax, let it go a little bit, and I go a little further. Okay, so that's the side body. I don't let go of this foot. I come up, I hook it with the heel, I got it, and I'm gonna come across the table, and I am gonna go to the outside. A woman may wanna go here, but as a man, I'm not going there. I'm gonna go on the outside, here, and pull the hip this way. So I'll do this on the opposite side so you can see. I'm gonna take it, here, and what I'm doing here is we're gonna get the lumbar spine and the lateral glute and a little bit here. What I want is this to go this way. This way. If I go straight lateral, if I go straight across, I'm taking her disc and I'm twisting them and I'm jamming the facet joints. That's gonna hurt their low back. You've gotta open the spine. Open it this way, here. And then I ask them, do you feel that in your glute or your low back? If it's the glute, you take a little bit off and you can work the glute, just right here. If it's the lumbar spine, I can get the skin, I'll reach under her shirt, and I'll just pull and do a little fascia release as you do this. And you can also muscle energy technique this. To do that, I tap them, say, bring this back to the table. Put that back on the table. Inhale. Relax. And there we go. So you do that on both sides. Then I like to end that sequence with a traction and a little rocking of the body, because that'll balance out any asymmetries that you may have created. So that's the hip sequence with the belt. This belt is by OTP. It's a good belt, but any brand will work.